I'd like to talk a little bit about how we treat hip flexor injuries or Psoas injuries with the Phoenix Waveform. This is something we actually see quite a bit in our office. Patients come in thinking they maybe got a groin pull. A lot of times maybe they're running, playing soccer, overactive that hip flexor. And a lot of times they come walking in, dragging that leg because anytime they contract that hip flexor, they got pain in there. Now it's a really hard area to treat because that psoas muscle that attaches onto the femur down here and the lumbar spine, it's deep. So it's really hard to do any type of release on the hip flexor. You can do maybe a little bit right up in here, but we found the Phoenix fantastic about treating that because it is such a deep type of muscle stimulation. So what we do is we typically use a 3-pad approach, where what we do is we will get a splicer on one and we will just attach 2 of the pads on one lead, so that you can get these splicers right off of Amazon, and it turns one lead into 2. And what we would do is I would take the pad, put it next to the lumbar spine kind of back here, and like the other pad over it. Yeah, obviously you're putting this on the skin, you're not putting it on the shirt. And then we take the other pad, and you can use the sponge or the sticky pad, and we have them put it right over that hip flexor on the skin. And what we do then is we use the 500 program, which is 500 contractions a second, and get these off. So what you're going to do is you're going to put that right here, and you're going to tell the patient or your client to hold it. And you're going to, the best thing is you have the patient lay down and bend their knees on the stand. So patients, or you're laying down, bent knees, you got 2 pads from one lead on the back, and the other one over the hip flexor kind of over here by the groin. You can use 500 contractions a second, you can use 300 contractions a second. Again, you want to do is turn that up to where you feel maybe a 6 out of 10 on an intensity scale. We don't want to go too high with this one. And this is definitely a different strain because this is actually going through the abdomen, the back. Your majority of your muscle stems can't do this, they're not deep enough, or they also cause the muscles to bind up. If you got a therastem or an arc wave, you can't do it with one of those, but those are the only ones that I'm aware of that you could do it besides the Phoenix. So what we'll do is, again, we'll have that client, the patient, close in here, turn the intensity up to get, like I said, a 6 or 7, and then what you want them to do, whether you're using the sponge pad or even the sticky pad. So we got the sticky pad over in their skin. You want them to push down on the pad, and then you want them to kind of move that pad around with the skin. So you're not putting your pad like your fingers underneath the thing, but you got it on the skin, just like on my pants here, and you kind of move it around. And what you'll do is you'll move around, and you may find a spot where that thing zings on the leg or up the back. And what you want to do is just kind of play in that area. So move it around until you feel that hypersensitive area. Now you don't necessarily have that all the time, but it helps you just kind of be even a little bit more focused and pinpoint that area. So again, you're laying it on your back, 2 pads. You can't do it with 1 pad on the back. You can do it. 2 pads just make a little bit more surface area. And like I said, this is a strange feeling because it is going through. But great success with this. Usually only takes a few visits. That's commonly used to treat the hip flexor injury. So, any questions at all, drop me a line, email, phone number, and I'll help you out any way I can.